Hi, everybody. I think there was a little bit of miscommunication with the links, and so a couple of you have reached out, and we're just sending those links individually. So I'm just gonna wait just a second. Also, I'm gonna try to get through this one a little bit faster than the last one, so there's more time for a Q&A after. I think I just got the heads up that we should be good. Okay, all right, I think we should be good. Okay, so I'm Betsy Nettemeyer. I'm a board certified physician assistant here at True Body. I've been practicing medicine for nearly a decade now. I started in family practice and then I opened True Body back in 2022. I do functional medicine, that's my department. I don't do anything with aesthetics anymore. Um, my passion is definitely hormones, supplements, and gut health, and so my first webinar was on hormones, and this one's on gut health. I specifically will be highlighting the GI map, the food sensitivity test, and we just have one more picks up here, BPC 157. So, I'm gonna go through this kinda quick in order to get a bunch of information out there, and a couple of case studies. But as I'm going, if you have questions, just put them in the chat, and I will try to get back and forth and check that and answer them as quickly as possible, but also hopefully we have enough time at the end to go through them all. I just wanna look at one more thing here. Okay. Okay. So, I'm gonna pull up the slides. I believe this should okay, perfect. Okay, so gut health. So maybe you know this, maybe you don't. 95% of our serotonin is made in our gut. Our gut is solely responsible for the hormones that we make, a lot of our immune system regulating things, a lot of proteins, our thyroid conversion from T4 to T3. So our gut is like your second brain. A lot of times when we're not feeling great, even if it's like not specifically gut symptoms like bloating or diarrhea or constipation, it still could be coming and it impacts absolutely everything. And so a lot of times when we feel like we've dialed in hormones or we've dialed in our supplements or we've dialed in all these things, but something is still missing, this is typically the piece of the puzzle that we need to dive into and look at. So I've got like mood and skin and energy and immunity and sleep and hormones as just kind of the primary things for gut, but there's even more than that, right? Each one of those categories can get deeper and deeper depending on, what your issues are, even if they're autoimmune. So, again, bloating and gas and constipation, those are pretty obvious things that we might have something going on. I have notes just in case I miss something and I go too fast. So those are pretty obvious symptoms, but then you have things like fatigue and brain fog and sugar cravings that like, I don't think that that's related to my gut. How could that possibly be related to my gut? When in reality, it all meshes together. I just had a client, this isn't even a case study, I just had a client who came in and, we started talking about her acid reflux, and she's been on Prilosec forever, and we're like, "You know what? Let's try to get off of that. Let's add some supplements to kinda control your symptoms." And literally within a week, she messaged me and she was like, "My acne is completely cleared up." And so times we're not really looking at we're not thinking about the gut when that's probably the major source of the problem. Um, so it's sneaky, it's really sneaky, and it's usually like the initial spot to go if we have something chronic going on, even if it's autoimmune. So, we talk about Band-Aids and we talk about root causes. So, Band-Aids would be like probiotics yeah. Would be like, probiotics, antacids, elimination diet, antibiotics. Those are more like I think I have, like, one thing going on. How do I get to the root cause of that? So we kinda put those Band-Aids on it. But, root cause is going to be diving into that testing and figuring out what exactly is wrong with your gut. What does your microbiome look like? Do you have a yeast overgrowth? Are your, pancreatic enzymes doing their job to break down certain foods? Do you have viruses? Do you have bacteria? Do you have bacteria that is there that shouldn't be there? Is there bacteria that should only be in your mouth that's actually surviving in your gut, and why is that happening? And so really looking at that microbiome, and then also what triggers do you have? Like, what foods could be a potential trigger? A lot of times we just think, like, if I eat clean, my gut health will be better. If I just eat, like, salads and chicken and just make it really bold, really, like, clean eating, everything that they told me on the top of the pyramid to eat, that all my gut health will be better. When in reality, maybe some of those things are actually triggering you. One of my very first clients, I did a food sensitivity on. She was like, "Man, I don't know what's wrong with me. I just feel like garbage, and I'm eating salad for lunch. I'm eating salad for dinner. I'm having chicken or shrimp or steak or whatever, and my dressing is just oil and vinegar. I'm like, it's nothing crazy. There's nothing in it that should be, like, triggering this." And we got our food sensitivity back, and it was romaine lettuce. So, she thought she was doing everything right, and obviously, she just didn't know what her trigger was, and so that's where we really get into the root cause of these things and try to figure out what can we eliminate. And a lot of times that doesn't mean we have to eliminate it forever. That just means we need to eliminate it for 3 months, get your body back on track, get that, inflammation under control, and then we can add it back in, and you can hopefully tolerate it, and you can live a normal life and eat normal things like everybody else. Make sure I didn't miss anything there. Thanks. 'Kay. Let me make sure there's nothing in the chat. Okay, there's nothing in the chat. Alright, so we use the GI map. When I first kind of got all these certifications in, functional health, there's a lot of different tests out there for gut health, and I chose the GI map because I thought it had the most robust data for the price. And so, basically, I'm gonna get next slide, I believe, has kind of what it would look like if you were to do a GI map, like what results you would get. So you can kinda look and see if that would be something you're interested in, but it's going to tell you what your bacteria balance is. So we all need bacteria in our gut, but there's if we get an overgrowth of certain bacteria, or like I was saying before, if the bacteria that's in your mouth is surviving in your gut, that's not a good thing. That means the pH is off. That means something is ruling the world in your gut and it's not allowing anything else to flourish. So as far as that goes, um, the next thing is parasites in yeast. We don't want any parasites, and we think of parasites as like, "I didn't travel to a foreign country, how could I have a parasite?" We have parasites if you have dogs in your house, if you have cattle or kitties or whatever, you are being exposed to parasites constantly. It's not like, "Well, I eat sushi, so yeah, I'll be a parasite." Yeah, you might have a parasite, but, it's just regular people who just live in Cody, Wyoming, who can have parasites, and it's actually that it is not. And there's an easy way to fix it. There's a nice little cleanse that we can do in order to get rid of those things. We also look at yeast. We need yeast, but if we have too much yeast, it can cause a problem, right? And so it's all about finding that balance. Like there's certain things that we need, but we don't need too much of, and we don't need too little of. So we got to find that balance. We got to figure out how to make that right. It's also going to go through your digestive enzymes, and those digestive enzymes are going to be what helps you break down food. If you don't have great enzymes, everything you're consuming is not going to get broken down. It's going to go right through you. It's going to cause a lot of bloating and a lot of gas. And you're going to be that person who's like, every time I eat, I'm in the bathroom within 15 minutes. That is not okay. And so those digestive enzymes to be doing their job too. And so those are kind of a big factor there. And then inflammation. Inflammation is paramount. I've had a lot of patients do just, like, hormone panels with me, and they come back with, like, elevated antibodies for, like, Hashimoto's for their thyroid, never knowing that they've had that before, and the big educational piece I have with them is inflammation. Inflammation is one of the big leading causes of, like, Hashimoto's and a lot of those chronic diseases because a lot of those things are made within the gut. And so if we're chronically inflamed, whether it's just stress our body has, because you guys have all been stressed or like anxious for something. I remember in growing up, like in athletics, friends would be like, "Oh my gosh, I'm so nervous for my race. I have to go to the bathroom." And so if your body has any sort of stress, your gut is going to be the first things to tell you that or remind you that you have stress. But also if your gut's just stressed out, if your gut is like, "Man, I'm just eating crappy food all the time. I'm never giving my gut a break. It's always having to process all these things," you're gonna create inflammation, and that is going to increase your, um, potential for developing chronic diseases down the road. And so just by getting your gut health under control, you can reverse those things. So potentially reverse a Hashimoto's, reduce how many antibody levels you have, get your get your hormones back on track, maybe even make some of your own hormones rather than needing so much of a replacement. And so that's huge. Um, and then immune function. How well is your immunity? How well is your immune system? Are you going to be able to fight things off? Because that also starts in the gut. Your ability to just be a healthy person and fight off viruses and bacteria and anything that comes your way starts in the gut. So that is what it's going to look like. I will stop guessing, start mapping. I love that. Okay, I hope you guys can all see this. I might just like, I don't think I can make it bigger. Do this, and you can't see something. So, oh, that's not gonna work. There you go. Okay. So in this top section here, I don't know if you guys can even see my cursor. So for you guys, like I think I hope it's your top left. Pathogens. It starts with pathogens. So pathogens, that's gonna be some things that we want. So a lot of that is like things that should be there. And also these are like screenshots of like real life people. You can't see any names, but so you'll see that some things are high and low and whatnot, which is good, I guess, for you to see that. But so pathogens, those are things that we want there to some degree, but we don't want too much of. Like obviously you don't want any C. diff. But some people do have a little bit, or you don't want an overgrowth. Sorry, you don't want an overgrowth of C. diff. Um, but you do want a little bit of it because it can help fight certain things off. And like as you go through that list, like there's certain things that are needed to process things, to break down food, to fight, for immune system, all those different processes. So that's what pathogens is going to look like, and it's going to look at different levels. So if something, for example, like C. diff, were way too high, we would treat it, right? And then the next section is parasites. Kind of lists all the different parasites that are usually the most common, what they are. Any parasite's bad, so we would want to get rid of all the parasites and do a complete cleanse. Just gonna make sure I can see that right. I think fungus. I literally can't even read that. So fungus, I think, is next. Viruses, intestinal health markers. Those would be like your enzymes, the pancreatic enzymes, the inflammation enzymes. Those kind of enzymes mean proteins, and where those are on that spectrum of like green being good, red being bad, or not enough of. Sometimes that means too much of those kinds of things. So where do you lie in that? And do we need to increase something or improve something to get some of those better or tone them down a little bit? The next one, I'm gonna like zoom in on here. Opportunistic overgrowth. So this would be just like things that are going a little haywire that we need to get under control. And what does that overgrowth look like and how bad is it? And they're broken into different sections. And those different sections mean like different things on what they do. And I can help you break that down depending on what your results look like. And we can go through it. Okay, there's fungi, yeast under there, and then viruses are under there. And then you have H. pylori. H. pylori is never a good thing. H. pylori can cause really bad acid reflux. It can also cause silent reflux, which can increase your risk of Barrett's esophagus, which is a precancerous change of the esophagus. And so those are things that we'd want to get under control. And not all of these require like antibiotics. A lot of these just would require like a supplement, kind of revamp of the diet, that kind of thing. There's bacteria, and then And then if you had H. pylori, this one in the top, I believe for you guys, it's gonna be the top right side is if you had H. pylori, is it resistant to certain antibiotics? If we needed to use an antibiotic, then it would tell us exactly what antibiotic to use for it specifically. Normally, when we test for H. pylori, we just test for H. pylori, like when you go to the primary care. As a primary care provider, that's all I tested for was, do you have H. pylori or not? And if you did, there's just like one routine for everybody. And so this would just like hone in on like specifically what antibiotic or regimen plan would be best for your strain of H. pylori. Let me check the chat really fast. Okay, nothing in the chat yet. Okay, next one. I think we're okay. So moving and before we go into that, I was just gonna show you. So you would get a kit in like a little cardboard box. You open it up. It's gonna have your order form, which I will likely have already filled out for you. Instructions. But you get. Let me just hold this up so you can see it. You get this bottle. So you'll fill this bottle up with stool to this line. It has like this little pink fluid in it, and it has all the instructions on it. You don't refrigerate it after anything. You stick it in this specimen container, and then you put it in this pre-paid FedEx bag, and you ship it off. I get the results back in about a month. It takes a little bit of time, and then you and I sit down together. We go through it one by one, and we create a perfect package just for you on what you need to do. It comes with also like gloves and a little container for collecting. So that's what it looks like. It's really, really simple. It's nothing crazy. I think a lot of people get like freaked out about what it's going to entail, and it's not a lot. So, okay, next is the food sensitivity stuff. I'm just going to kind of browse through all this pretty quick. So if you do put something in the chat, I will check it here in a second. So, okay. Fuel or trigger? What is the answer? So food sensitivity, when people tell me like, "Oh, I'm just gonna go get allergy tested, and see what my triggers are," that is not the same thing. So an allergy test is an IgE test of sensitivity. IgE is an immediate reaction. So those are usually people who are like, they're getting like the little pricks on their body where they like just like prick them and they put like the allergen in it, whether it's like pollen or foods or whatever in it. And then if you have a reaction to it, okay, you're sensitive to that or allergic to that or whatever. That's IgE. IgG is a chronic sensitivity. So it's different in the fact that a lot of times these foods, we're not going to get like a trigger right away that says, oh, I'm immediately allergic to romaine lettuce. It's going to be like, am I chronically allergic, sensitive to romaine lettuce? Do I need to cut that out completely because my body has mounted such a response that I chronically will always be sensitive to this, and it's going to cause bloating or diarrhea or constipation or something in my gut for me. So that's kind of the difference. It's a delayed immune reaction. Common symptoms of delayed reactions would be like brain fog, acne, fatigue, joint pain. And I've listed the top surprise foods in here: eggs, spinach, almonds, and avocados. A lot of times people are like, yeah, I'm eating good, I'm eating eggs. Or I have a salad of spinach and avocado on the side with a hard boiled egg, and then I sprinkle it with like slivered almonds. And it's like, those are actually like the top ones that I'm super surprised, but are usually a problem. So that's why it's really good to know what these triggers are. Um, it's always surprising to me. So this isn't like a comprehensive view of it, but this is kind of what a food sensitivity test result would come back as. So the middle bottom portion of this with like the yellow highlighted is telling this person what are the top results. So it's got um, anywhere from like +1 to plus, I think, 4 as far as like the severity of sensitivity. So 4 being the worst, 1 being the least sensitive. kind of deal. And so the low results are the ones that are highlighted in yellow, and the top results are the ones that are red. So they usually, are the ones that they're most sensitive to are the top ones. Now this is interesting because if, let's say you were, sensitive to spinach, but you hadn't eaten it in, like 4 weeks, it likely won't have a number 4, like a high sensitivity, because it wasn't just your body wasn't recently exposed to it, so it's gonna probably be in there on, like, the 1. So just because something is a 4 or a 1 or somewhere in between doesn't mean, like, that one's, like, so, so bad. It probably means that you exposed your body to that one more frequently or most recently. So just something to think about. But yeah, in this particular person, it's saying, like, okay, kidney beans and, um, plantains, which are not bananas, they're plantains, and baker's yeast and brewer's yeast, which is like yeast for everything. They've just like covered all of it, right? Are things that you completely need to weed out. And then everything below that is definitely something like to avoid. So we're like, okay, that's a pretty good chunk of foods. And so the nice thing about this test is that it's going to give you a recommendation, a food plan recommendation. And it'll give you at least 4 days worth of like suggestions, but then it'll list like numerous. I want to say it's over 100 things that you could eat for like protein and fruits and condiments and beverages and all those different sections that you can eat. So it can kind of create some meal plan ideas so you don't have to just be like, well, frick, I don't know what to eat. I can't eat anything. So it gives you kind of what that should be. And then the other part of this that we can add on, you don't have to add these on, but add them on, I usually just do, is the subtypes of eggs. So you have whites and you have yolks. So this particular person was a +3 for both of these things, so they would want to avoid both the yolks and the whites. And then you're gonna go over to the next part and you're gonna get sub-fractions of milk. And so you're gonna get casein, and then you're gonna get all the different subgroups on the right-hand side. And so it kind of tells you, like, it says, like, individuals with casein should avoid cheese, anything positive to whey proteins, which are those other subgroups over there, should avoid whey or whey products. So it can kind of give you some recommendations, but also it's going to give you the exact subtype. So that when you're going in and you're buying like protein, for example, you're trying to work out, you're trying to increase your protein, you're like, okay, which protein can I not use? And you can look and be like, okay, if it has the LF whey in it, I'm not going to eat that at all. So it gives you a lot of help rather than just being like, all whey is out. I can't have any. It gives you kind of that now. If you were positive to all of those, then yes, you would want to avoid it entirely. Um, so it's helpful. It's helpful to really like hone these in. With this test, you are going to want to avoid these foods for 3 months, typically, and then you're gonna slowly introduce them one by one, starting with the ones that, have the smallest number, the 1s first, and then the 2s, and then the 3s, and then the 4s. And if something is continue let's say, like, you feel really, really great, and then all of a sudden you're like, "I don't feel great," and it's because I added in, um, barley. Okay, maybe that's something we just avoid for the time being. So it'll give yourself a little bit of education also on like what things are just going to be straight up deal breakers. And then we've got a 5R protocol. And so you remove it, you replace it, you re-inoculate it. That's important. A lot of times people are like, well, man, I really like Baker's. Um, we can re-inoculate it at some point. We're just avoiding it temporarily. We repair the gut, and then we rebalance. And so I've kind of got like some things over to the side. Repair, I don't have a slide on this. I just wanted to touch on it. There's BPC 157, which is a peptide I have right here. You can do it orally, which when you're doing gut health, you would want to do it orally, or you can inject it. And that's more for like tendons and muscles, but it's going to repair the gut. And if you do that with another peptide called KPV, that can also help with inflammation and healing. And so we can do supplements, We can do antioxidants like glutamines and glutathiones and zinc and collagen, all this things to repair to some degree supplement-wise, but then there's some robust peptides that can really help us get off like our omeprazoles and our acid blockers and those kinds of things, and hopefully never go back on them. Okay, so 4 people, I'll make this quick. I know I've got like 5 minutes here. So Jessica came in with bloating, fatigue, and weight gain. So we did GI map and a food sensitivity. On her GI map, we found H. pylori and yeast overgrowth, and we found several food sensitivities, and we were able to completely reverse those symptoms for her. And it didn't take a full 3 months, which was great. And she was able to reintroduce foods and kind of get back on track. Amanda came in with acne and anxiety, and we basically did. I think we just did a GI map on her, and we were able to basically improve that imbalance that she was having. For just like the gal I said at the beginning of this webinar, completely resolved her acne, which was huge, and her anxiety improved significantly. And we would have never thought of those 2 things being an issue, right? Especially for like gut being the problem. Mark had reflux and fatigue, and we fixed also from H. pylori, fixed that and fixed his food triggers, and no longer needs to be on a antacid anymore, and feels like he has way more energy, and did not do any hormone therapy or anything like that, which was huge. And then Derek came in with joint pain and brain fog. And he thought he had leaky gut because he was like, man, every time I eat, I just gotta go to the bathroom. Otherwise, I can always struggle with like, diarrhea or constipation and that kind of thing. We found like a ton of inflammation in his gut, and we were able to get that dialed back down. Completely resolved his joint pain and really improved his brain fog. And these are just real people, real root causes of everything. So I thought that was huge. Okay, so what do you do? So basically, you can come in and you can just talk to me. We offer those free consultations. So you can just come up to me and decide what test you'd be best for. I'm gonna be honest, these tests are best for everybody. Like you can't go wrong just learning this information about yourself and really understanding what your key triggers are and what you can do about them. This is so empowering for you. And I guarantee you're not gonna walk away from this and being like, wow, my gut's 100% amazing, or I have no food sensitivity. I'm definitely not gonna walk away saying that. So I think this is like great for everybody and anybody. Um, and then we're gonna create a full plan for you. I can do this virtually. These I can mail these to you guys if you don't even live in Wyoming. I can mail them to your house. You can steal them. You don't have to be part of Wyoming. You don't have to be part of your body. If you know a family member who could really do it, one of these, get them on the phone or buy one for them and take them on the next family get together and be like, I got you this kit. You should go in the bathroom and just do this. I think they would get a crack out of it, but they probably appreciate it at the same time. Um, and then for those of you who are speaking to the program, so for a limited time, you guys all get 50% off one or both tests. You can do them both. You can do one. I don't really care. You get 50% off. If you're a VIP and you choose to purchase one of the kits, you still, get your discount. But in addition to that, you get an IV. So you get a complimentary IV when these are purchased. We'll add in some glutathione and some great antioxidants just to kind of help cleanse the gut. If you're not a VIP and want to be a VIP, when you call, just let us know and we can get you set up with that. We will honor that. So that's always there for you guys. And I think I only have one more thing. Yeah, symptoms are your body's signal, not the enemy. So let's test and not guess. So I'll just leave this up. I was just going to check, make sure. Would you eat it before a test to see if your body's actually sensitive to it? Okay, so question is, if you're off gluten, would you eat it before a test to see if your body is actually sensitive to it? You certainly could. If you don't know if you have a gluten sensitivity and you've just been like assuming all this time that you may have a gluten sensitivity, certainly you could. It's definitely going to help pick that up for sure. But I think if you've done the homework yourself and you've been like, man, when I don't eat gluten, I feel a lot better, then it's probably not worth your body like going through that and creating a whole inflammatory process just to know. And we'll be able to pick up other things other than just, like, a gluten issue, and so I wouldn't. You could, I wouldn't. I would just be like, "You know what? Gluten's not my deal. I already know." It still may come up as a thing, so be like, "Well, just 'cause I haven't eaten gluten, maybe it's not." It still may, 'cause there's a lot of things that we think don't have gluten in 'em, and we try really, really, really hard not to eat gluten, and it still might have a little bit of gluten, even though it's, like, not disclosed or anything like that. So it's still a positive, but also if you've already done your homework and you're like, "Every time I eat gluten, I just know it's just gonna throw me for a tailspin," probably just avoid gluten. Um, we can also do specific blood tests for that, and we can look at certain antibodies for gluten and celiac sensitivities, specifically if that's something you're interested in, rather than putting your body through that torture as well. So I would say no, but yes, you certainly could. Any other questions, guys? I went really fast through all of that. Um, I didn't wanna go over, and we're already 2 minutes over. Look at me. You're so welcome, babe. Um, so yeah, if you want to, get any of these tests, please call. We're gonna offer it for 24 hours, so limited time. Um, they're they're only going to be helpful for you. I've personally done them both. I was shocked both times. I thought I knew my body really well and still came back with things that I was like, "Hmm, I would have thought." And it's really made a big difference for me as well. A lot of times people are just like, "Well, is your skin great because you just work there and you're just using all the products and the lasers and stuff?" To be completely honest, I have not used basically half of our devices here. I do medical grade skincare. But I think a lot of it has to do with me optimizing my gut and my hormones. I think that was a big game changer for me. And once you've lived that, you know the impact it has, you just wanna share it with the entire world. So, um, I hope, um, I hope this type of care isn't limited for you no matter where you live or whatever the case is, but if it is, I'm happy to do virtual appointments with everybody, help everybody out if I absolutely can. So I appreciate all who listened to the webinar. We'll put this up on our YouTube channel, True Body Aesthetics and Wellness, probably in the next 24 hours if you wanna watch it again or share it with a friend. So, good to see you all. Take care. Bye-bye.